Welcome everybody, Dr. Ben here, FA Well Centers. Excited to talk today about your questions, answer anything you've got, hopefully health related, but I am here to answer questions about you, loved ones. Hey Kitten, good morning, good to see you. Pop down below where you guys are watching from. I'll give you a shout out. If you don't have a question, just say hi. If you do have questions, put them down below. We usually go for anywhere from 45 to 60 minutes, and I could go all day long. There's questions nonstop. So if you've got questions, get them in first, get them in line, and I'll just go through that one. So again, love seeing you guys. Let me know where you guys are watching from. We see people all over the world, South Africa, Ireland, Australia, all over the place. So put those questions down below. Love seeing you guys. And again, I'm Dr. Ben Gallagher. We have offices in Colorado, Highlands Ranch, which is outside Denver, Fort Collins, which is northern Colorado. We have an office in Tennessee, Brentwood, which is right outside of Nashville. Amazing doctors that work with patients all over the country. We work on hard cases. We work on chronic conditions. We work with people that are going to be really looking at the underlying why that they're getting these issues. Hey Carol in Tennessee, Marianne, good to see you there in Germany. Great to see you. We've got a comment here. I was born with elephant man's disease, neurofibromatosis. That's Heidi. Great having you on, Heidi. Again, if you guys have questions at all, anything at all, I know we've got some coming in that we had from other patients. So we had a bunch of questions this week on digestion issues. And so why do people have digestion issues? Why do I get reflux? Why do I get heartburn? Why do I get burning, pressure, look like I'm pregnant, any of these different things? And it really comes down to you're not digesting like you're supposed to. So think about this. There's certain things that need to happen when we digest. Certain things like you chew your food and saliva breaks it down. That gets broken down enough and the chewing motion breaks it down. It gets into the stomach, and then you need to have enough acid in that stomach then to break things down that way. And then once it gets to a certain pH, then it's going to move into the small intestine, and you need to have enough enzymes coming out of the pancreas in there as well. And you need to have a good barrier so that it is absorbing appropriately. And then it needs to get into the large intestine, and then the large intestine needs to have the right microbiome. Hey, Gloria in South Carolina, great to see you. Again, anybody else on here, pop down below where you guys are watching from. Love to see you. Any questions at all, health related. We work on chronic conditions, all types of different things. So gut, if there is reflux, indigestion, heartburn, anything that is up top, that is a stomach issue, that is usually going to be because somebody does not have enough stomach acid, is going to be a big part of that. Hey, Minzy in Shelbyville, Kentucky, good to see you. And so for most people, they are diluting their stomach acid. If you're getting reflux, indigestion, heartburn, bloating, anything like that, you probably do not make enough of the there's a question, enough stomach acid. And so as we stress and as we age, we don't make enough stomach acid. So if you're not getting enough, you need to stop drinking fluids with your meals. That's step number one. If you're having heartburn, reflux, and digestion, don't drink fluids with your meals. Start there and see what happens. But I'm going to jump into some of these other questions. My husband's PSA is 5.6 and he is 59 years old. Is that considered high? And if so, what can he do to lower his PSA level? Yeah, 5.6, I would consider that high. And again, you've got to figure out why that PSA is high in the first place. Is it an inflammatory condition? Is it because of the blood sugar? You'd want to look also at his DHT to see if that testosterone is spilling over into the testosterone. You'd have to look at other inflammatory processes. Is there a cancer component to it? In which case there's a metabolic most cancers are metabolic syndrome related, meaning that cancers is fed by blood sugar imbalance there. So Megan, what causes brain fog? I have chronic sinuses. So brain fog, that's the $1 million question there, Megan. Brain fog can be caused from a lot of different things. Blood sugar going down can cause brain fog. Blood sugar going up can cause brain fog. Low cortisol levels and adrenal crash can cause brain fog. Food allergens can cause brain fog. If you've got yeast, gut, microbiome imbalance, that can cause brain fog. So many things can cause brain fog. So again, it's the same thought process, Megan. When we go through with a patient, we run this net out as wide as we can. We look at hormones, we look at adrenals, we look at thyroid, we look for autoimmune, we look for inflammatory, fatty liver, we do a brain map, look at what's going on inside of the brain, all of these different things, and try to figure out the underlying why. And so that's the big thing that I'm looking at is, why is this body not working right? Why is that brain fog actually there? Chronic sinus issues, that's another one. You've got to look into mold. There could be mold in your environment. If you're living down in the basement, if you've got wet anywhere, if you know you've got leaks, anything like that, you've got to fix the mold. Chronic sinuses, you can also look at maybe you had a injury to it in the deviated septum. We do a technique called nasal specific, where we take a balloon into different nasal passages and inflate it with a blood pressure bulb and adjust it from the inside out. It's amazing. If you're in the Colorado area, come see us and we can do that one on you and make some massive, massive changes there. How do I deal with pounds? Hold on. And hey there, North Idaho, Atlanta, Philly, good to see you. How do I deal with pounds from food poisoning over a year ago? I'm assuming, I don't know if that's low weight or excess weight. So if you have lost weight because of food poisoning, haven't been able to put that back on, you are probably still damaged gut lining. And you need to go through and you need to do, we call it the 4 R's, where you remove the pathogens. So you do kill off the oil of oregano. Brittany, pop that link down below for that one. That's an amazing product that we do. Time-released oregano. You can kill off the bad bacteria, yeast, all of those things, and then you can remove any of the food allergens, gluten, corn, soy, dairy, any of those big ones, and then you can get into the re-inoculating after you kill off, bring in the good bacteria. Don't just start with probiotics. You've got to do the kill off first and then the probiotics, and then you can repair that gut lining, glutamine, marshmallow root, aloe vera juice, a bunch of different things that can be helpful there. And then you can replace any enzymes, stomach acid, gallbladder, bile salts, things like that. So you've got to do the work to actually repair that if you cannot gain weight, if you're still having issues after that food poisoning. Again, we've got Leslie in North Idaho, Tammy in Georgia. My daughter has slow bowel and lesions on ileum, but doctors don't care. This is Jenny from the other block. So here's the deal. If your daughter has slow bowel, you've got to figure out why she has slow bowel in the first place. And one of the main things that causes the bowel to move through is going to be the peristalsis, and that's going to be vagal nerve tone. Give me a thumbs up or a star, heart, anything if you guys have heard of the vagus nerve. So the vagus nerve comes off the brainstem and it stimulates that peristalsis, it stimulates that movement. And if it's not firing like it's supposed to, then you are not going to be able to move your digestive tract like you need to. There's some hearts coming in. Thanks, guys. So yes, you've got to get that going. Gag, gargle, and hum. Those are the 3 basic things that you can do to get that vagus nerve going. Every time you brush your teeth, make sure you're gagging yourself. That stimulates that vagus nerve. Every time you drink water, gargle, but gargle pretty darn strong to where your eyes are almost watering. And then hum. Not just but like where you're getting that vibration at the top of the mouth, and that's going to be stimulating that vagus nerve. The best way to do it, not everybody's favorite, is a coffee retention enema. Not just a coffee enema to make yourself poop, but a coffee retention enema where you hold that coffee enema as long as you possibly can. It starts stimulating the nicotinic receptors, fires that vagus nerve, and it's one of the best things that you can do for your daughter there, Jenny. Jazza player in California, good to see you. Think I have a stomach problem with garlic. Is that a legit thing? Yeah, so here's the deal. Some people, garlic, onions, I had a guy yesterday, avocado, different foods can stimulate the stomach differently. You know, some people, they have like the avocado banana latex thing, their mouth gets weird. So yes, there are different things. And if you're feeling it, the old saying is when in doubt, keep it out. So if you're feeling it, keep that one out. So again, Dr. Ben Gallagher here, FA Well Centers. We have physical offices in Colorado, multiple in Colorado, one in Nashville, Tennessee, and we work with patients remotely all over the country. If you're not getting the results you want, we can drop ship blood work straight to your door, get it back within a week, and let you know exactly what you have going on, what's out of balance. So this is Heather. I started taking CoQ10, and it took my cravings away, but then I started getting heart flutters, stopped taking them, and the flutters went away. Cravings are back. Why did that happen? Hey, Heather. So interesting on that one. Let me get back to that question there. I'll highlight it. There we go. So, you know, why did that happen? CoQ10, a couple things. Maybe it was the type of CoQ10. Maybe it was not pure CoQ10. I've never seen that where the heart would flutter with CoQ10. It's usually got some heart protective benefits to it. But you know, for the cravings to go away, that's kind of weird too. I've never seen CoQ10 be productive at cravings going away. But you know, if it causes the flutterings, then I would definitely not do that. That could definitely be a negative. So you may want to try some other forms of CoQ10 there. Can you tell me why I cough until I burp after I eat? So this is Monkey Game 1998. So you have this muscle, it's this tent-shaped muscle right under the ribs here, and that's called your diaphragm. And that diaphragm can get too tight, irritated, in spasm, things like that. But in that diaphragm, there's a hole, and the esophagus, when you eat food, it goes down that esophagus, goes through that hole, and then into the stomach. So right at that diaphragm, right where that hole is where that junction is, that sphincter. And so if the diaphragm is too tight, if it spasms, anything like that, it can restrict food going down, it can go into tightness, and so the coughing can be that diaphragm trying to release. So here's what you need to do, not just at that time of eating, you need to work on calming that diaphragm down. You need to focus on deep breathing techniques, even 7 seconds in, 7 seconds out, 7 seconds in, seconds out. Really focus on diaphragmatic breathing is going to be helpful. If you have any physical therapists, chiropractors, massage therapists, anybody that can do a manipulation on the diaphragm, that can get that to get out of spasm as well. But yeah, this is probably a diaphragm issue. Let's get Heather's away here. Hey, Megan's in Nebraska. Annette, is there a test to determine if a person is more likely to get dementia? Here's the deal. Write this down, and if you guys have concerns about this, if your family members have had Alzheimer's or dementia, you can run a test and check to see if you have the genetic predisposition for this. And so there's certain markers that we look for. And so there is a genetic test, and there's certain carriers. You can be a 2 or a 3 or a 4 on this test. And with that, you can, 2 or 3 is fine. So like my wife is fine, but I am a E4 carrier. It's called APOE. And if you're an E4 carrier, then you are 2 to 4 times as likely to get Alzheimer's. And if you have a concussion, you're 10 times as likely to get Alzheimer's if you're an E4 carrier. I am an E4 carrier. I've had multiple concussions, so I do a lot of things every single day to keep my brain as solid as possible. Fortunately, 3 of my boys, I have 4 boys, 3 of them if you remember the Punnett square. So I'm a 3-4, my wife's like a 2-3. And so 3 of my boys are not an E4 carrier, but my oldest son, my 18-year-old, is an E4 carrier, so he's more likely to get Alzheimer's, so we do more for his brain, etc. So the APOE test is the one you want to look for. If you're E4, then you absolutely have higher rates. Your brain is not going to repair as well, and you need to do a lot of different things to keep that going. So Annette, great question. If you can't get that test, if your doctor won't run that, let us know and we can do that. This is Steph. My 13-year-old has ulcerative colitis and on infusion treatment, still not seeing full remission 2 years. So here we go, ulcerative colitis. It's not a gut disease. We're looking at an autoimmune disease. So just by suppressing that immune system, just by suppressing the inflammation, does not fix these underlying issues. So you've got to take a step back, Steph, and you've got to go, okay, one, yes, we need to work on the gut, but we need to work on the gut lining so that leaky gut goes away. We need to work on the microbiome and get rid of the bad stuff and bring in the good stuff. We need to work on the gut as far as having regular bowel movements and all those things. But then you also have to work on the blood sugar and the adrenals and the brain and the stress response and all of these other things that are going to be driving that autoimmune. Brittany, pop down below for Steph the YouTube link. So on our YouTube channel, we've got over 700 videos, anywhere from 5 to 60 minute long videos, way more in depth than a lot of things on TikTok or different places. And in there, I've got tons of information on autoimmune, and you've got to start digging deep. If you can't get the results, Steph, shoot us a message. Click the link in the bio for anybody on TikTok. Click the link in the bio, schedule that discovery call for anybody on Facebook or YouTube. Send us a DM, and we will talk to you about what you need to be doing. Like the dance. I'm 3 days in with my supplements. I feel so much better. Thank you. Awesome. Good to see you out there. Who are you working with? Not sure on the name there. Bonka, I have IBS from food poisoning over a year ago. My gastroenterologist says he can't find anything. Yeah, so here's the deal. Whether he can find anything or not, you've got to go through north to south. Make sure the mouth is working there. Make sure the stomach is working there. Make sure the small intestine is working, large intestine, gallbladder, liver, peristalsis, all of those different things. It can be fixed, guarantee. If you're not getting the results, if your GI doc is not fixing you, click that link in the bio, schedule that discovery call. This is Carol. My husband doesn't like doctors in the traditional medical system and now is having enlarged prostate issues, maybe worse. Any recommendations for nutrition supplements? So supplemental is the go-to for the supplement world with prostate issues. But ultimately, Carol, he's got to take a step back. And like me and my FA doctors, we're not traditional medical doctors that are just wanting to pump him with a pill, cut out his prostate, whatever it is. He's got to go in depth, and he's got to look at inflammatory markers. He's got to look at insulin resistance, metabolic syndrome, prediabetes. Is there any type of inflammatory process going on? Does he have fatty liver? All of these different things, and then we can say, okay, now we're ready to start moving our feet, and that prostate, very good chance that it can actually go down in size as they start doing that. Hey Jerry, good to see you in Fort Morgan there. Megan, I have fatty liver. Well, that's great, because you know what? Fatty liver is reversible, Megan, and we see it all the time. I've had patients that were even on the autoimmune liver list that's for a liver transplant, and they were able to reverse that. What would cause slightly high lymphocytes? How can I reduce them? So here's what you want to look for with lymphocytes. So get out your blood work, and if your white blood cell count is below 5, if your lymphocyte percentage is over 38, and then even if your liver enzymes, your AST and ALT are starting to go up a little bit, like over 20, then you probably have a chronic viral condition. So this is infinite expansion. So you probably have a chronic viral issue. Most likely it's Epstein-Barr virus. It's the monovirus. That's the most common one that we see, but there's other ones out there that can do it. And so you've got to get your body as strong as feasibly possible so it can fight these things off. So that's the big thing. Yeah, even though you've got those lymphocytes, you've got to strengthen your body and get them as strong as possible. You can take lysine, you can take immune system, echinacea, whatever, but you've got to fix why you're depleted in the first place, because there's a lot of people that carry Epstein-Barr virus mono with them long term, but they don't have it reactivated. That's one of the big reasons why people are having the long COVID symptoms. And can you fix a deviated nasal septum? Yeah, so that's what we do with the nasal specific. We put the balloon up the nasal passage, inflate it multiple ways, and we will see major, I've seen people from the outside, their nose actually comes back into line. A lot of different things can get through there. Is Crohn's disease dangerous? Yeah, absolutely. If you have Crohn's disease and you're not dealing with it, you're not fixing the why, you're not healing up the gut lining, you're not stopping why that inflammatory damage is going on, that is very dangerous. People can die from Crohn's disease. So you absolutely need to take massive action, figure out the why, food allergies, kill off bad stuff. You need to bring in good bacteria. You need to work on the immunoglobulins, that immune system in there, all types of different things. So IBS, brother. So here's the deal. IBS is a syndrome. IBS is not a disease. Kind of like fibromyalgia, kind of like chronic fatigue. A lot of these different conditions are not the true disease. They're just symptoms that they label. So if you have IBS, if you've been labeled IBS, then you need to figure out why. You need to figure out why your gut is not working like it's supposed to. And that's the amazing thing that we're able to see when we start taking this massive action. The blood work you check, will it detect Addison's disease? Yes, so we're checking cortisol and DHEA in there, so we're able to see what those adrenals are doing as well. That's Jenny, and good, we got through those. Let's jump over here. Hey, Kayla in Southern California, good to see you. Hopefully the weather cools off for you guys soon. I did have sinus surgery with the balloon. It made it worse. I can't smell or taste, ongoing for 3 years. So Megan, did you have somebody insert the balloon, or was the sinus surgery with the balloon? Because we may be talking about two different things. Marissa, I am insulin resistant and am trying to lose weight with diet and exercise. Would I benefit from this, or should I take the new Monjaro shot they are talking about? Not too fond on taking new things. This is the only thing you should be shooting into your body. This is a continuous glucose monitor. With that glucose monitor, every one of our new patients gets it, along with a finger prick glucose monitor. We're able to figure out exactly what is going on. So here's the deal. Somebody goes on Monjaro, and guess what? Then they're going to maybe lose weight. Maybe it craves their appetite a little bit, calms it down. But what happens when you stop taking that? What happens when you get tired of spending that money, or you want to do something different or whatever? You're going to go back and gain the same amount of weight because you didn't fix the systems that were out of balance. You didn't fix your liver, you didn't fix your gut, all of those different things. So if you're insulin resistant, the number one thing you can do is start tracking your blood sugar. This is why I did my master class. This is why I wrote my blood sugar book. All of these different things. You've got to truly fix why your body is insulin resistant, why you're having these cravings, all these things. Just going on a shot is not going to fix it. So, and Kayla, I have my report of findings today. Very excited to get the results of blood work and know what to focus on. Thanks for the work you do. Kayla, awesome. Great to see you. Which office are you going into? So Kayla has gone through her startup process. She had her blood work done, did her exam, went through the information, and now she's going to sit down with one of our doctors, FA doctors. We've got multiple around the country, half dozen doctors that work directly one-on-one with patients. And so that's awesome. Good to see you. And How do you lose weight if you have no gallbladder? Well, the simple thing to do, if you know, and this isn't even about losing weight, and most people, it's not that they can't lose weight because they don't have a gallbladder, but here's what you do if you don't have a gallbladder, is you look into taking bile salts, B-I-L-E, bile salts, and those are going to be replacing the bile so remember, the gallbladder holds the bile, liver kicks it out, stores it in the gallbladder until you eat something fatty. It squeezes that out, goes into the small intestine, and then can break down the fat. So that's why you felt bad when you had gallstones or whatever was going on, and you were like, oh, if I ate some French fries, I would want to die. But here's the deal. You are not overweight because you don't have a gallbladder. That's not the story. Guaranteed, there are other things going on. It may not be helping, but that's not the whole story. You've got to look at your blood sugar. You've got to look at your inflammatory processes in your body. You've got to look at your fatty liver, your thyroid, all of these. Your gut is a huge part of it. I just did a talk Monday on this, or on Tuesday, and we talked about this study where all they did was put the mice on the standard American diet in this study, and their microbiome changed dramatically, and they all gained weight and got insulin resistance, all kinds of things. I don't take any pharmaceuticals, but been doing some homeopathics as well. Good. Yep. So Susie, gallbladder. I'm not going to say that it has nothing to do with weight, but it has something to do with it. And for a lot of people, though, I do a video all the time that it's probably not your thyroid. For the majority of people, thyroid does not have to do with their weight. There's way more other things going on than just the thyroid. That's kind of a easy cop out there that. That's not the whole story. I've been trying to get vagus nerve looked at, and they won't. We come to your office September 29th. Jenny, awesome, good to see you. If we need to, might be doing that coffee retention enema. We'll do whatever it takes, right? Tips for reducing lymphocytes. We already talked about that. You got to get the immune system working better. And ineffective esophageal motility in a child. So again, that's the esophagus. This is the esophagus right here, and it is not moving things through like it's supposed to. Vagus nerve is really a big part of that. I would work on the gag, have them hum, do some of those things. That depends on how old they are. They may not be able to do the coffee retention enema, but you've got to also go through, do a complete neurologic workup with a functional neurologist, and they're going to check for primal reflexes. They're going to look at cross-crawl patterns, all types of different things. So look up a functional neurologist in your area. If you're close to the Fort Collins location within 8 hours, come in, see Dr. Jake. He is world renowned in that part of the field. For 21 years, I have had no stomach. Wow, that's intense. I would not want to be going down that road. Thanks for giving advice for free. It's very expensive to go to the doctor very often. God bless. You are so welcome there. Let's see what we got over here. Best natural way to stop acid reflux while it's active. How about this one? Baking soda. Put baking soda in water, drink that down, and that's going to be the best way to stop it while it's active. But here's the deal. That's a one and done. It's not going to fix anything. You've got to get to the underlying why. Why does somebody have reflux in the first place? So most people are going to be thinking that it's because they make too much stomach acid. But here's the deal. It's not because they make too much stomach acid. It's because you're probably too little stomach acid. I don't know if I've ever seen somebody that had too much stomach acid. It's because there's too little. As you age and as you're under stress, you produce less stomach acid, and so then you're not going to be able to break the food down as well as you should. It sits in that stomach too long, and it starts pushing back up onto the sphincter, and then we get the regurgitation, we get that reflux. So you've got to make sure that food goes through. So here's your tips. Proper food combining. Keep your proteins and your starches separate at meals. Do not put those together. Number 2 is you're going to not drink fluids with your meals. Do not be drinking water, tea, Coca-Cola, wine, whatever. A couple little ounces, a little sip here or there is okay, but no other fluid with your meal. Number 3, you're going to sit down and eat in a relaxed environment. Shut your laptop, get away from your desk. Don't eat on the run in the car, whatever it is, and you're going to have dramatic changes in that reflux. So good job there. Had my ferritin, this is Teresa, had my ferritin check, 299. What's my number 1 favorite blood work marker? Teresa, you've been watching. Ferritin, love it. That's my #1 marker. Ferritin high, inflammation, insulin resistance, fatty liver, all this stuff. Low, anemia, but leaky gut, malabsorption, not breaking it down like you need to. So also low vitamin D, TSH at 39.6, cholesterol, and ACL elevated, all and nothing but the results from the doctor. No need to be concerned. I am very concerned with that. I am very concerned with a ferritin of 299. Okay? I don't want ferritin in a female over 125. That is absolutely 100%, 99.9% of the time, it's going to be some type of insulin resistance, inflammatory process. You need to look at your C-reactive protein. Your TSH is high. You've got hypothyroid going on. You've got a blood sugar issue guaranteed. You've got insulin resistance creeping in. Check your GGT. You might even be getting fatty liver. I am very concerned, Teresa. If they're not checking out, if they're not concerned, send us a DM and we'll get you on the call for a discovery call and go through the process there. So absolutely, you should be concerned on that one. Let's see. Hey, I have some low back spasms off and on for a year, and sometimes it's so bad I can't move. How can I prevent this? So low back spasms, look to the front first. Look to your core first. The thought process is like what they teach in Pilates. And so think about it this way. If your back is in spasm, it's usually because your front is not firing like it's supposed to. You get your front to fire like it's supposed to, because we've got this give and take. So as this muscle contracts, this muscle has to relax. So as this contracts and gets stabilized, this is gonna relax. But what happens is people are like this, sticking out here, and then this goes into this extra spasm there. So again, it's here. So you're pulling in underneath that belly button, activating, it's called the lower transverse abdominis, and you activate in there. I like to even do squats where I do this and I pull that in the whole time, and you'll feel that band pulling in there. As you do that and get that stronger, it's going to take those low back spasms away. One of the easiest ones you can do is feet about 2 feet out from the wall, and you try to flatten your tailbone and your sacrum against the wall and pull in right through here, and you get that to activate, and that low back will relax. Jenny, will chiropractic be able to help with the vagus nerve at all? So depends if they are trained in the functional neurology. If they are, then yes, that is going to be a good place to go. Should I have surgery for hyaluronia? So I can't tell you whether to have surgery or not, but what I can tell you is there's things that you can do for a hyaluronia. If you know somebody that can do a visceral manipulation, whether that's a chiropractor, a massage therapist, a PT, anybody that does manual work, even a DO, and you pull in, and as you breathe out, you squeeze through there. Look it up on YouTube. Just look up a hyaluronia maneuver. Have your spouse do it even. You can definitely get some work. If it's like a sliding one, if it's really, really bad, you got to do what you got to do sometimes. But you've got to make it so that your digestive system in your stomach is so much better that it doesn't even get affected by that. So proper food combining, proteins and starches separate. Keep your fluids down to like 1 or 2 ounces per meal. Eat in a relaxed environment and chew your food 30 times per bite. Giant gut, ER says it's not air, bad pain, super winded, neck, spine issues. Skywatcher. So I would look into digestion. It could be the microbiome. You may be fermenting in there, and you've got to do kill off and build back up. Do you help find any genetic mutations, specifically vitamin D? So most people that we work with are vitamin D deficient. And then we give them vitamin D and it works. Occasionally, some people that doesn't work and there can be a genetic mutation, but it's very, very rare. I've tested tens of thousands of people with vitamin D, and I don't, maybe 1 or 2 people, just no matter what we gave them, could not do it. So you may just not be taking the right time. All right, Kayla, what's the first treatment step for dealing with menstrual cycle mood swings? So, Kayla, it depends on the person. But the first place that we want to start with, depending on what the brain map shows, is stabilizing the blood sugar. So, if someone works with us, they'll get a continuous glucose monitor. For those of you at home, you can use a finger prick glucose monitor. Start stabilizing that blood sugar, because almost guaranteed there's going to be some highs and lows. We see with dips, we see what we call random anxiety, and that is a huge part of the problem. The other part is there may be a brain component to it. If you did a brain map and you're local, we can do what's called neurofeedback. If you're not local, we have a home unit that we can do that as well. So, great question. What is the best way to test for celiac disease? So it's super easy. It's a blood test, and there's certain markers that you're going to look for. And most doctors will run that. Although they most only check 2 markers. There's like 15 at least that we can run. So they may miss it. But if one of those 2 common ones show up, then yeah, you got celiac. You should never eat gluten again. But here's the deal: it can take up to 3 to 4 years once somebody gets off gluten, and what happens then is their gut can start healing up, and then leaky gut can go away, and malabsorption, all those things. But for our patients, even within 3-4 months, we'll see that gut heal up even with full-blown celiac. So DM Short, 1939, Crohn's disease, ulcerative colitis. I have to have my immune system. Okay, yeah. So you've got some major gut stuff, autoimmune things. You've got to take that step back and just start working through system by system, like we do with all of ours. Jenny from the other block, we can't wait to see you. My daughter is a complete mess. We need your help. Go to Tennessee, September 29th. Awesome. So excited, Jenny. We're gonna get to the bottom of it. I don't know what it's gonna look like, but we're gonna get to the bottom of it. And my bile duct is 14 millimeters. Do I need to worry? Let's go here. My bile duct is 14 millimeters. Do I need to worry? You definitely want to get that checked out. I mean, I assume you've had a scan already. Have you done another talk with the doctor? What do they want to do? Do they want to do surgery? What's going on from there? But ultimately, whether you get the gallbladder taken out or not, you've got to work on that digestive tract. That's not going to fix anything. No matter what supplement I'm taking for vitamin D, my levels are still low. Gene mutation. Yeah, potentially. I mean, it's very, very rare. That could be part of it. Have you tried a liquid form? Have you tried it with fat? Some of those things. My daughter had her gallbladder out and is still in a lot of pain almost 2 years later. Yeah, Nettie, it wasn't a gallbladder issue. I mean, maybe the gallbladder wasn't great, but that's not why she was in pain. Absolutely. That could be a huge part of it, is that gallbladder, was not the issue. You've got to look at the stomach. You've got to look at the mouth. Are they salivating? Are they chewing? Do they have enough stomach acid? Is the pancreas secreting enzymes like it needs to? Does she have leaky gut? Is there microbiome imbalance? So all these different things. Is she in chronic fight or flight? You can be in fight or flight, or you can be in resting and digesting, but you cannot do both at the same time. So I would check her brain as well. My brother tried CoQ10. He felt horrible. Yeah, interesting. My siblings are on statins. Scary. Yeah, it's not good. Aldi Silva, good to see you. What's the treatment for PCOS, polycystic ovarian syndrome? I love this one because it's so simple and it's not this rocket science thing. It's an insulin resistance. They put young women. I've seen 18-year-old girls that are thin, skinny, get put on metformin, which is a diabetes drug. Why? Because they know there's such a connection between insulin resistance and PCOS, polycystic ovarian syndrome, where you get cysts on your ovaries. So you've got to dig deep and figure out why those cysts are there, and what you can do differently in order to change that metabolic state. Continuous glucose monitor. If you guys have not seen one of these yet, it's awesome. You get to see 24/7. You get to see where your blood sugar is and know exactly which foods are good and which ones are not. So PCOS, you've got to be tracking your blood sugar. Step number one, 100% of the time. I have leaky gut and PCOS. Yeah, both of those are absolutely fixable. Would love to talk to you about it. Send us a DM and we can go through what that process would look like. Kimberly O'Hare, high ferritin. Yep, 186, 125 is the cutoff. I'm sure inflammation, low iron, blood sugar consistently 85 to 110, GGT, AST, ALT, hypothyroidism due to TT, all levels good. What else could cause low iron? Dropped 30 points in last year. Thank you. But your ferritin is still high. There's something else going on. I would look in the, and again, when is your blood sugar consistently 85 to 110? Is that in the morning or are you testing all day long? And so look into that. And then I would look into leaky gut, malabsorption, some things through there. And Sherry, what can you do for a severe arthritis in a knee, which is almost bone on bone, and for pain? I'm coming to Denver in 2 weeks, watching from Kansas. Hey, Sherry, awesome. You get to go see Avery and Dr. Katie and Sean over there. They will do amazing work with you. Just a wonderful, wonderful team. Just great, great hearts. So here's the deal. We have so many patients that they've had bone on bone in their knee and joints and shoulders, whatever it is. And yet we get that inflammation down and they're like, I can do squats. I can do all these different things. So it's a global inflammatory issue that's going on. And as you get that better, you are not going to potentially need to do that knee replacement as soon as you would have. So we've seen a lot of patients be able to push back their surgery just by getting their inflammatory process down. All right. I've been having issues with kidney and UTIs since my gallbladder removal. This is the cosmic blue star. I would look into scar tissue work, massage therapist, PT, chiropractor, anybody that does visceral work, because if there's a scar tissue in that gallbladder, it can pull and cause these stress lines. So it can pull down into the kidneys, the bladder, different places, and that scar tissue can actually make it so it does not empty like it's supposed to, etc. So I would look into scar tissue work. Can you calm down testosterone levels in females, decrease acne and hair growth? Yeah, Jenny, this is what we were just talking about, PCOS. Absolutely. That is insulin resistance. That's metabolic syndrome. That is your blood sugar. Once you get this CGM on, you're going to be able to see exactly why that goes up. My 18-year-old, he lost 15 pounds by putting a CGM on. He wasn't overweight dramatically or anything, but he was still eating like a 15-year-old growing teen, and he's now 18 and doesn't do sports like he used to, all these things. And so he started eating still the number of carbs, and he saw, wow, I ate 5 corn tortillas and blood sugar went up to 180. So what if I eat 1? What if I eat 2? He figured that out and lost that weight. But absolutely, that testosterone level, because remember, if a female has blood sugar issues, major blood sugar issues, insulin resistance, they'll hold on to testosterone. If a male has that, he'll actually spill his testosterone into estrogen and get man boobs. My doctor diagnosed me with gluten sensitivity years ago and never mentioned it again. Well, Alicia, I hope you're not eating gluten. If you really do have a gluten sensitivity, you do not need to be eating gluten at all at this point. What do you recommend for pelvic floor dysfunction? Any type of therapy? Yeah, there's certain physical therapists that specialize in that. There's different exercises you can work on. It's a pretty in-depth thing, and depending on what the original cause was, it can take some time and energy to do that. So fibromyalgia, I love this one. So think about this. Fibromyalgia is not a disease. And that I might get some hate messages here. Fibromyalgia is not a disease. It's not a treatable thing because it's not a thing. It's a syndrome. It's a diagnosis. It's not a disease. Fibromyalgia, there are reasons why you have fibromyalgia, and that's what you have to fix. So anybody out there that's been diagnosed with fibromyalgia, get that out of your head, because there's no treatment for fibromyalgia. There's treatment for adrenal issues that are contributing to that, and your elevated cortisol or decreased cortisol. There's treatment for thyroid issues, and the reason why the thyroid's out of balance, and that could be causing this pain and achy and all the issues with fibromyalgia. There's treatment that you can do for the gut and leaky gut and inflammation. There's autoimmune conditions that you can look for that you probably have going on. All of those things can be dealt with, but fibromyalgia cannot be treated by itself. So that's my rant, and you guys can go off on me if you want. But Joe Joy, hi Dr. Ben, what infrared sauna do you recommend again? Brittany, go ahead and put that in there for Joe Joy. Not sure if you did yet, but yes, it's the one, the head sticks out of it. It's amazing. We've got it actually in our bedroom. We've got a massage chair and infrared sauna. My wife, say a little prayer for her. She's still recovering. She had an 11 millimeter kidney stone that had to be removed on Monday. She worked for a week trying to pass it, but just could not get that thing out. And so she's still recovering, but with the anesthesia and all that stuff, she's in that sauna every day now, getting those toxins out of her body. So Brittany, go ahead and put that link in there, and it's awesome. It's infrared. Your head sticks out, so it can go up to like 170 degrees, and you can get really warm inside, but your head doesn't get too hot. It's awesome. I love that sauna. Second round of COVID at the moment. What vitamins should I increase or stop taking? Thank you. Any over-the-counter you would recommend for the terrible cough? Thanks, Doc. Amanda. So I would do. This is what I do with my family. We'll do for 3 days. We'll do 50,000 IU of vitamin D for 3 days, and then go back to your normal dosage. That can jumpstart it. Vitamin A, high dose vitamin A can be helpful for a couple days. You can do your zinc, selenium, quercetin, a bunch of those different ones. There's some topicals out there that I can't talk about on social media that are very helpful as well. Liver level not good, kidney level not good, huge gallbladder stones. Should I get it removed? Again, Amanda, I can't tell you whether to get your gallbladder out, but what I can do is your liver levels, you got to figure out why. It's either metabolic syndrome, insulin resistance, your blood sugar's off, or there's some type of liver issue going on as far as two things: toxicity or a chronic viral infection. So look at lymphocytes and look at white blood cell count. But yeah, I can't tell you whether you should get it removed, but you do need to fix why all of these things are out of balance. Which hormones cause anxiety and irritability around that time of the month? So, here's the deal. It may not actually be anxiety and irritability from the hormones being out of balance. It could be that your blood sugar gets more out of balance and that you're crashing. And when that blood sugar crashes down, we call it random anxiety. And then you're going to, I've had teenagers that go home at middle of the day because they're texting mom, I can't handle this. They're freaking out. That blood sugar's crashing. Sometimes just those, when those hormones get enough out of balance, it uncovers and stops blocking some of the brain stuff that you underlying have. So you may have just this underlying anxiety and irritability, and when the hormones get out of balance enough, then that rears its head, and so you need to do what's called a brain map and figure out where that anxiety and irritability is coming from. Do I have Hashimoto's? So this is Tresha. Do I have Hashimoto's? I don't know. Here's what you do to find out, though. You test TPO antibodies and thyroglobulin antibodies. You test two antibodies. You can have a couple different types of Hashimoto's going on there, and then you'll know. And then you'll know whether it's an autoimmune condition or not. Hi, doctor. My young daughter has leaky gut, very low iron. Periods are out of whack and has fatty liver. She's feeling tired, and doctors have said there isn't much that can be done for her. Please help. Is there any hope for her? Oh my gosh, that breaks my heart. Kim, you are so welcome. Roshana, that breaks my heart. That is the worst thing ever. Doctors have said there isn't much that can be done. I mean, that is absolute BS. Your daughter, if she has leaky gut, you can fix that. If she has low iron, that can be fixed. If she has, her periods are out of whack, that can be fixed. If she has fatty liver, she probably is creeping into PCOS and some other issues there as well. And it's insulin resistance and the blood sugar swinging all over the place. Do not buy into that. Send us a DM right now. I'm just sick hearing that. That's just, I'll get over it, but it kind of wrecks my day that those doctors are telling people these things is horrible. You know, how can you even say that? Well, here's the deal. They can say it because they don't have anything for it. It's not that they purposely are saying, oh, there's nothing you can do when there are things that you can do, but it's basically there are things that you can do, but they don't know about them. And that's what we do every single day at FA with our patients. Wondering if how we eat, not chewing enough, can cause big problems. Absolutely. How you eat is everything. How you eat is everything. That is the foundational piece for almost everything that we do. So you need to chew 30 times per bite. You need to, in a relaxed environment, eat. You need to smell the food ahead of time, get your juices flowing. You need to have enough stomach acid. All of these different things are going to be major issues if they're out of balance. Ferritin at 15, thyroid antibodies 83, wheat IgG 15. Yeah, Trisha. So ferritin at 15, you have a significant malabsorption, leaky gut, something going on because the ferritin, that's the stored iron, is really low. So leaky gut, malabsorption, not enough iron, some of those things, and those thyroid antibodies. So you have Hashimoto's. So yeah, that is, if that's TPO, then yeah, that's Hashimoto's. But here's the deal: you got autoimmune, you got leaky gut. Let's roll. That's how you fix that. That's going to be sweet. You talk about anti-immune disease. What should I do about it? You never said. What do you do if I told you I have it? Okay, so this is Tara. Tara, Brittany's gonna Brittany on TikTok. Go ahead and give Tara that YouTube channel. I've got tons of videos, anywhere from 20 to 60 minutes. You know, I don't have enough time to get as in depth into that. I've done hour and 45-minute workshops, tons of things. But here's the deal. If you have autoimmune, which is Hashimoto's, rheumatoid arthritis, lupus, ulcerative colitis, Crohn's, alopecia, your hair falling out, any of these, then that is going to be this autoimmune, the body's attacking itself. You've got to then take a step back. Which of these systems is causing that body to go haywire? Because you can't just suppress the immune system and think it's going to be fine. So we've helped people heal from MS, from lupus, from rheumatoid arthritis, amazing changes because they did the work. It's not me, it's not my doctors, it's their body that is actually healing and regenerating. Difference between soluble and insoluble fiber, examples. So, you know, I don't get hooked on it. Eat lots of vegetables, any fruits that don't make your blood sugar get out of balance, and you're gonna be fine. I just turned 40 and now I'm getting migraines and pain in the right eye. Why? I know patty cake. So here's the deal. There's so many different reasons why you might be getting migraines. Maybe your hormones are starting to shift. It could be a menopause related type of a thing. It could be you finally worked long enough at a computer and your head's forward and you're starting to get some structural issues that way. There's a lot of different things that we get going on, but I would get a hormone panel done and just see where that is. Rebecca, I'm so sick of being sick. I'm tired of pain meds. My doctor says I'm too complex, but let's add more pills. Yeah, another one. Yeah. You know what? You probably are complex, Rebecca, and that's okay. It's okay to have, you know, if every one of our patients was, you know, as complex as you, we'd probably only be able to see X amount. But thankfully, you know, a lot, just like I was saying, people would, oh, I got leaky gut and Hashimoto's, or I got leaky gut and PCOS. You know, those aren't even complex. We can fix that stuff all the time, or we can give the body the ability to fix those things. But for you, you know, no matter what it is, there's got to be reasons why. Are you ever going to feel 100% be you know, back like when you're 20? I don't know. But is there hope? Is there a potential for your body to be as vibrant and strong as feasibly possible? Absolutely. So that's what I want you to get figured out. And send us a DM, Rebecca, and we'll get this figured out for you. My son suffered from C. diff a while back. Is something we will have to deal with every time he is on antibiotics. Tabitha, first thing, why is he going on antibiotics? You know, because yes, that is definitely potential. You've got to get everything working as well as feasibly possible so that he never has to go on antibiotics again. That's what it comes down to. If it's a sinus thing, you got to fix that. If it's a tooth thing, you got to fix that. If it's a gut thing, you got to fix that. Whatever it is, the immune system, you got to get it working as well as possible. All right, I'm gonna have to jump in a couple minutes here. How do you fix joint pain? Depends on what's the deal with the joint. If it's a elbow that was injured and now it's starting to have arthritis and things like that, you've got to maybe do some rehab, do some things like that. But overall, you've got to get that inflammation down as much as feasibly possible, and you've got to get it to where if it's all joints, then you've got to get that global inflammation down. Look at your C-reactive protein, your CRP, look at your ferritin, check non-fasting insulin, all of these different ones that are going to be telling you where that inflammation is coming from. And we're going to be able to figure this out, why that inflammation is there, get it down, and then that joint pain can start going away. We see it all the time. Can you reverse mixed connective tissue? Autoimmune, same thought process. Can Bartonella be healed from the body? Absolutely. You can run down. Okay, I got to jump, guys. Rebecca, you got an appointment the 28th. Awesome. So excited. You are going to see some massive changes. Move your feet. We're going to figure it out, and you're gonna get some change, because if we're your last hope, you've still got hope, and that's the biggest thing. So here's the deal, guys. I'd love to think all of us doctors, all of us at FA, my new patient coordinators that you talk to on that discovery call, my metabolic coordinators that you'll work with on a weekly basis along with our doctors, all of these different things, we're hope dealers. And that is the biggest thing I want you to get out of this Q&A, reaching out to us, any communication with FA, is that there is hope that your body can get better. There is hope that you can truly live a different life than you're living right now. Your loved one can live a different life than they're living right now. They can do more, be more, give more. And that is what you were put down on this planet to do, is to be a world changer, to be a giant killer, not to sit there in pain, not to sit there in agony and just fatigue and just wondering who's going to help you. That is not the life that you were supposed to live. Click that link in the bio, schedule that discovery call if you're on TikTok, if you're on Facebook or YouTube. Send us a DM, and we would love to sit down and talk to you, go through this process. Whether you can get into the Colorado or Tennessee offices or anywhere in the country, we will sit down with you one-on-one, come up with a game plan, exactly what you need to be doing. So love you guys. Really stay positive, stay hopeful. That is the biggest thing that you can possibly do to get your life back. So anybody that's coming into the office, so thankful for you guys taking that massive step. My team, they're going to be here for you to support you in every which way. If you're coming to see me, great. I'd love to talk to you as well. Take care, guys.